questions until now that
Just
what we are learning?
Just to confirm, I
Yeah.
am Vata with like combination of it.
Combination, yeah.
Okay.
Dominantly is your Vata.
Okay.
So the dominant is like more Vata, but put your name because you are using the same book for your wife also. So
Yeah,
put
yeah.
your name in front of it. I do not want both of you to get confused, or
Yeah.
I can give the separate books.
No, that's fine.
Okay. So now as you have a history, now let's start from the top to the bottom.
Okay.
Okay. Now because you just shared that important thing, the accident.
Yep.
Long time back. So it's called it as something with the Vata also.
Mm-hmm.
Okay. Aghadajavadi. Aghad bole to like something where we get the impact on the body. Okay. External injuries.
Yep.
Not the internal. It came something with your accident, which is 10-12 years back, and when you are now 43, that means your age was like 30.
30.
30?
Yep, 30, 31. Yeah.
And here in US,
Yes.
bike.
Yes, I was biking and a teenager guy who was just learning how to drive.
Shit.
He kind of ran into me. He stopped. So I was at the intersection. So he was coming from this side, I was coming from this side on my bike. So he stopped, but he only looked at this side just to see if any car is coming or not. And then he took a turn. He didn't saw that I was on the other side. I stopped. When he stopped, I started going, but he stopped and only looked at one side, not at my side. He didn't see me and just kind of ran into me. So I flipped and fortunately landed on the side of the road.
Oh gosh.
Yeah.
Yeah, that's so scary.
Yeah.
My goodness, flip 2-3
Yeah.
times.
I don't remember. It happened so fast.
My goodness.
Like I started riding my bike and I flipped and got on the side of the road.
Okay. So let's talk about this concept and this, because with your accident also you have a lot of range of motion challenge. So we'll do some subtle asana practices. This is called it as a sukshma vayam. Sukshma means micro wala.
Yep.
Micro means something which is you are doing very gently and slowly. It's not like a big movement you will see, but the effects will be very powerful. And it has always done before doing the main asanas. Okay, so it's like a pre-stage of doing the asana practices. So are you comfortable in this one?
Yeah.
Okay. So let's practice some with your arms first, and then we will practice something for the TMJ.
Okay.
So let's sit like, bring your both legs forward and bring your left leg at the base and right leg on the top. Okay. So it's called it as a heel on heel. Yeah, pretty good. Now bring your both arms. Okay. As you have a range of motion challenge in the right hand, we are thinking all about that now, and we'll start from the top. Okay. So what I want you to do, inhale. Look at me. Inhale. Bring your elbows back. It's not like forceful. It's happening with the breath. Okay. Exhale. Again. Bring it out. Reach out. Inhale. Exhale. Reach out. Inhale. When you are inhaling, your chest is coming forward, your elbows are going back. Good. Exhale. So in and out. So when you're bringing the in, it's like your chest is coming forward, your lungs are getting the more oxygen, and hold a little bit like so that let it walk nicely on the body, and then exhale nicely. This is one. Now bring your both arms as your right range of motion is hampered. So bring your right hand to the left knee. Okay. Left hand behind you and support, on the ground, palm facing down, and lift higher. Okay. Now inhale here. And when you exhale, bring your nose to the knee. Inhale. Lift higher. Hold your breath nicely here. Exhale, lead with your heart. Lead with your heart. Do not lift your hip area or the butt area, okay? So it has to be on the ground. So your both butts are on the ground. That means you're not lifting anything in the back, okay? You're just lengthening from the core.
Yep.
Okay?
One quick info for you on that. My core, so whenever I have to do stretching, let's say if I have to reach my toe or something, I cannot bend that much. So my core is tight. It's not flexible enough. So this area is very tight. Like whenever I have to stretch myself from the core, I cannot go too far. So if I don't lift my butt, then I cannot reach my knee.
It's okay. So just stay where your breath is out.
Yeah.
Don't just, reaching is not important, G. What is important is like working on that flexibility of the muscle.
Yeah. Yep.
So do not lift any of this here. Keep it as close to the ground as you can. And only what is happening is like extension, movement from the core. We're moving from the core. Okay, it's okay. So if you're only here, just stay there.
Okay.
Then start a little bit deep breathing here. I'm just showing you at home, you do nicely. So nice breathe in, nice hold, nice breathe out. So then slowly move. And then maybe after a month, or maybe after 2 months, you will feel a little bit ease on that. Okay, it's okay. So this is the one. Okay. Now bring the left hand to the right knee and the right hand goes back, support your back. Why this is important? To bring this palm facing down and support the lower back. Because we do not want the hands exposed. Okay. So now inhale here, lift. And exhale, do the same. Lead with your heart. Inhale, do it at your own pace, 3 more times. Hold your breath, chin up. Now, here, look at me. So this is chin up. Open your neck. Look up, chin up. Your vision is on the ceiling. Exhale, lead with your heart. Feel the connection between your abdomen and your thigh. Inhale. And exhale at your own pace. And slowly come up. And come out of the pose. Okay. So now, just to open up a little bit back, now we'll go to the top lumbar area or trapezius area. The muscles which are holding this area where you have that range of motion challenge, it's the mid part of the trapezius. So trapezius is like, it starts all the way from here, from the hook, maybe in the head part, that notch. It starts from there and it comes like this, then it comes like this. So this is from top to bottom, one of the major muscle of the back. Okay. So now let's walk our hands and walk it like very slowly. Again, we are not lifting the butt part. Our hips are on the ground. And just reach wherever you can. Keep your fingers active. Okay, now inhale here. Look, G, look at me. Inhale. Look at my fingers. Very good. Look up, chin up. Exhale to the floor. Inhale. Exhale. In. Look up, chin up. So this movement is happening also in the neck, okay? And exhale. So see where your forehead is, whether it is on the ground, connected on the ground,
And if you bring your both arms behind, interlace your fingers
Okay.
and have some good time here, in and out. And feel a nice connection of your thigh, up your feet, your pressure is between the feet and the abdominal organs, lower abdominal area. Enjoy that, whatever you just said to me. Deep breathing in, deep breathing out. Feel the movement in the lower back as well as in the abdomen with the in and out. Alright, slowly come up. One by one vertebrae.
Very good. Okay, so this is just a little bit with the shoulders, range of motion. Okay, now bring your left hand on the ground, palm facing, fingers pointing forward. Okay, and keep your elbow locked, close to the body, close to the hip. Is that how you lock? Look at my elbow.
Okay.
Okay. Now inhale.
I feel like this is.
Yeah, that's why I'm teaching
Okay.
you this. Okay. So inhale through the right. Now here you are connecting all the way from your lower back. So the muscles next to the vertebrae. Call it as paraspinal muscles. I will show you maybe later on. So we are reaching, and at the same time when you are reaching to the sky, you are pushing the earth. Stretch yourself nicely between the two. Reach, engage your core, your abdominal area, abdominal muscles. Now exhale to the left. Very good. Exhale to the left. Now get your left hand and reach out to the right and stretch nicely. Point the fingers. Open up. Open the elbow. Good. Look up, chin up. Now look at me. The hands, the elbows are locked. Can you lock your elbows? It's okay. It's okay.
Yeah,
Inhale up, reach to the sky, and release. Slowly feeling into that area where you have that range of motion challenge. Okay, now you can talk. Sorry, when you are in the pose, it's hard to discuss.
So I'm not able to stretch this arm.
Yeah.
Probably because my arm doesn't come over as much or doesn't go as far, but
there is tightness also, so
yeah,
a lot of tightness and stiffness.
Okay. When we work on the massage, I sometimes have upper back tightness. So if you can, I don't know if you noticed that yesterday or not.
We will work on it like this is how yesterday is like more like a mapping of your body.
Yeah.
Today I'm feeling that I would like to work a little bit on your head part.
Okay.
Because there is a lot on your head to clean it out. And then I'm definitely going to work on the yesterday I also did the stomach part a little bit longer, but my intention is to open up the stomach as well as the mid upper and mid back. So today will be more focused on, as you just told me 2 minutes back, that you had that accident and which you missed to tell me. Last time also and yesterday also. So my intentions will be today more going on your upper and mid back also.
Okay.
Okay.
Excuse me. Do you plan to do Shirodhara or
today? That's what I planned it already. Because of that, that's why I would like to do the Shirodhara today. That's why I asked you, Yesterday's work, we removed a lot of things.
Yep.
So I hope you washed it in the morning.
Yeah, I did.
So today my intention is to start from there.
And I did not apply any gel or anything. Usually I do, but I did not apply anything today.
I don't expect anything on the body when
Yeah.
somebody's coming to Ayurveda.
Yeah.
I tell all my ladies clients, do not put any makeup,
Yeah.
anything. Just come with a nice bath, that's it.
Yeah.
So this is with the right hand. Okay. Now let's finish with the left hand. Okay. So now right hand is on the ground, fingers pointing forward, next to the hip, next to the
Yeah.
butt. Simple language, but next to the butt.
So see this, I cannot. I don't know. I have to point my shoulder up
Mm.
to lock it. Otherwise, it stays like this.
It
So-
will open up. Practice all what I'm teaching on this thing. You
So
prac-
when I look at you, it doesn't appear that your shoulder is up. And I feel different.
Mhm. I
So
see that.
okay.
I see that. It's a very. It will open up as you will release the tightness from the lower back, upper and mid back.
Okay.
Yeah.
It has nothing to do with the length of my arm, with the size of my body, or anything like
You
that.
are a long person. You're not short.
Okay, but I don't know how the length is distributed between my core and my legs, and I don't know if it has something to do with that or.
Let's talk about this. Maybe I will take some pictures today if
Okay.
you allow me, and maybe after a few days, let's recheck.
Okay.
When I will see you during the follow-up after the cleansing program.
Okay.
Well, let's practice few of the things what I'm teaching you every day, and
Okay.
keep doing that at home. I know you do orange theory and all of that, but that is totally different. Okay,
Yeah,
what you will be learning here, I really want you to practice on it, so that your whatever you are just explaining, all of this will feel better, and you will improve and increase many things in your body.
So, at the end of this week, is there a way you can provide me some name or picture of the asanas that I can do on my own?
Mhm. That's why you have the books right
Okay.
next to you. We are going to mark on it.
Okay.
Yes.
Okay.
Okay.
Yeah.
All right. So your right hand on the ground, pressing to the earth. Now inhale through the left, fingers active. Lift higher. Reach to the sky and push the earth. Stretch your body in between. Inhale, look up, chin up. Your vision is at the tip of the fingers. Now exhale to the right. Your left hand is going to the right. You are engaging all the way from this area, sir. So
Yep.
from here. So this is called it as a lateral flexion of the body, and you are using a lot of obliques here. Look up, chin up. Look up and chin up. Your vision is on the ceiling. Now bring your right hand, interlace your fingers and reach out. Point and reach out. Stretch nicely. Nice. Your vision is still on the ceiling.
Yep.
Look up. Inhale in the center. In the center, look up. Hold your breath nicely, engage your core muscles, and exhale. Exhale. So scapula. Your shoulder joint is made up of scapula, which is coming from the back, and this bone, humerus, and some of the muscles from this area. Okay, so this is all for them. Okay, now grab your shoulders. And this is very important for you for that reason. Exhale. Very good. Inhale. Bring your elbows back. Hold nicely. Enjoy that stretch. Exhale. Inhale. Hold it there. enjoy that stretch. Nice smile on the face. Exhale. Okay, so this is one variation. Okay, now we are going to do into the circular form. So we are going down and front. So look at me. Down, front, up to the sky, elbows to the sky, and back, down. Now we will create a rhythm here, a motion here, and down. So now inhale until you reach to the sky. Lift your chest. Exhale. In. Out. Do it at your own pace. Very good. Okay, now we'll go into the opposite rotation. Okay, so inhale up, exhale down. So what we did the same in the front, we are going to do the same in the back. So forward, backward, clockwise, anti-clockwise. Good. Okay. So write it down few of the words.
Are there any pages that I need to mark or?
No, these are not. This is a very individual teaching.
Okay.
So I will tell you what to mark so you will remember it. And also one more thing, I will explain it to you, G.
So where? Okay, I
Yeah.
can write somewhere right
Yeah.
here.
So put your name on the top. So sitting asanas for shoulder problem.
Okay.
Okay, so we did the hands forward, breathe in and breathe out. Palm facing up.
Okay.
And right hand up, going to the left side, side flexions. So side, the flexion of the spine. Up is breathing, going to the sideways is exhale.
Mhm.
Okay. And interlace the fingers, both hands. Okay. And the third one, right hand up, reaching to the sky, left hand pushing to the earth. Repeat. Other side. Okay. And then this one, in and out, elbows forward, elbows back, and shoulder rotations clockwise, anti-clockwise. I hope you will remember with this.
Okay.
Okay. So tomorrow we will learn about the jaw.
Okay.
Because now I have to take you for the session.
Yeah.
The massage session and Shirodhara session. Today we will do the Shirodhara a little bit nicer way so that again we can remove a little bit all the dry stuff what is in your scalp area. And did you have a good bowel movement today?
Yeah.
Okay. And what time did you eat the dinner yesterday?
Around 8.
What time did you sleep?
I would say around 9 o'clock, 8:39. I slept for a little bit when I got home. Then I woke up, had dinner, and then went to bed around 9 o'clock or so.
And what time did you get up?
I woke up really late today, around 7.
क्या बात है? It's
Yeah,
late
I
for
slept.
you, right?
I slept well.
That's
I-
so good.
yeah.
Like, you know, maybe because you were a 4 a.m.
Yeah,
person,
yeah,
right? And
yeah.
you slept until 7, that means
Yeah.
you were really in the heaven.
Yeah. No, I got a good night's sleep.
That's good. I'm happy for you. So on the table, what today we are going to do? Let me see 1 minute. We will go to the massage room, and we will start with the Shirodhara today.
Okay.
Okay? Give me, I will keep it for you. And on the face up. Okay, like yesterday. Everything is same like yesterday. Okay. I will knock before I come in.
So I'll keep the books here.
Yeah.
You
You are the only one. After you, your wife will be here. So,
Okay.
yeah.
Let me actually use the restroom.